See, this is we got an advisory from Government of India recently, 2 days ago, and yesterday we had a meeting on this with the health experts committee that what we have had right from the COVID times. So where actually we have members from different health facilities. So where we also discussed about what is this virus is all about, and what has been shared by the Government of India too. We also have discussed. So HMPV is actually a known virus, not like a something not unknown virus, and it creates flu-like symptoms. So basically, the cause of concern was that whatever the reports that actually the media has brought out is that there are a large number of cases in some parts of the world. So how actually that can have an impact in India. So what we have seen is that first of all we try to look at all the we call influenza like symptoms, like what kind of how many fever cases are there across the state, and are there any trends that there is a surge in those fever cases. So there's no surge, there's no unusual pattern that we can see in our state. So there's nothing to be worried about that one. At the same time, we also have we also have been using this opportunity to really strengthen our own health system. So basically just to look at it like how we are again orienting all the doctors. Basically we are taking those measures to see that to especially to see that especially the pediatric cases, focus on those pediatric cases, making sure that they are provided they are properly monitored and properly taken care of, so that we will not have any such kind of a surge, further transmission, if at all, if there is any such transmission happens. Currently there is not even a single case or anything that is reported in the state. So there is no immediate cause of concern on this particular issue. So that's what we have issued an advisory, and so from the health department side to the residents of the state. Now, ever since the COVID, in fact, the state government has taken a very proactive steps. Built a lot of infrastructure. So ICUs have been there. For example, Ganesh Das Hospital has now ICUs, like a very state-of-the-art ICUs are there. So there are places where actually you can immediately give care.
What about the oxygen?
Oxygen, we have enough oxygen actually. In fact, every day actually we have the oxygen liquid, oxygen, the units are there here in that earlier the COVID center in Umsawli. So it can manufacture almost like more than 1,000 cylinders a day. So if we need, we can produce a lot.
Any cases in Meghalaya so far?
No cases.
Okay.
No cases as yet. In fact, we also have we have a very the state has set up a very thorough diagnostic center. You might be aware, we have these RT-PCR machines now, so we can detect everything now. It's not like before. So we can actually have the ability to detect the viruses within the state, and we also actually have a method to really look at on a continuous basis. The Pasteur Institute collects samples, including from the wastewater, to see are there any viruses strains are there. So we have that entire disease surveillance system now very proactively working on. So far nothing has been detected.